Good day everyone, I am Agatha Mamaril from BSN 2C and today I will be demonstrating the Sputum specimen collection. But before that, let us first identify the purpose or the aim of collecting the sputum specimen. This is to identify any bacterial, viral, or fungal cause of suspected infection and its sensitives to antibiotics. A specimen is indicated if the patient has clinical signs of infection including productive cough and purulent sputum. Also, signs of systemic infection, and lastly, pyrexia of unknown cause. For the assessment, here are the areas or points to be assessed during the sputum specimen collection. First, assess the overall health of the client related to the test being conducted, and then assess the need for the collection of the sputum. And then lastly, assess for the need of personal protective equipment. For the planning, prepare all the needed equipments and supplies such as the CHN OB bag, the sterile specimen bottle, clean gloves, mask, and goggles, and then the transport container. Prior to performing the procedure, introduce yourself and verify the client's identity using the agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can cooperate or participate. Magandang umaga po. Ako po si Agatha Mamaril, student nurse po mula sa Nueva Ecija University of Science and Technology. Maaari ko po bang malaman ang inyong pangalan at edad, ma'am?
Maria Cristel Chloe Warke, 14 years old.
Ayan po. Ngayon po ay magsasagawa po tayo ng sputum specimen collection. Ito po ay ginagawa upang malaman po natin kung meron pong bacterial, viral, or fungal infection po ang inyong plema or sputum po na tinatawag natin. Maaari na po ba natin itong gawin? Perform hand hygiene and observe the infection control procedures. If the client can perform tasks without the assistance after the instruction, leave the container at the bedside with the instructions to call the nurse or the healthcare provider as soon as the specimen is produced or available. Check the label and the client's identification. The label should include the client's name and identification number, time specimen was collected, route of collection, and then the identification of the person obtaining the sample. Put on a set of gloves and goggles. Place the client in semi-Fowler's position and then have the client clear her nose and throat and rinse the mouth with water before performing the procedure. Usually, the specimen collection is being done early in the morning before having breakfast. Ask the client to breathe deeply and then cough up to 1 to 2 teaspoons or 4 to 10 ml of sputum. For acid-fast bacillus or the AFB, which also requires the following collection, often for 3 consecutive days. This is to identify the presence of tuberculosis or TB. If the client procedure sputum, open the lid of the container and then have the client to expectorate specimen into the container. Follow special precaution if tuberculosis is suspected of obtaining specimen. Ask the client to cough up or expectorate the sputum into the specimen container. Make sure that the sputum does not contact the outside of the box. If the specimen container becomes contaminated, immediately wash it with disinfectant. Remove the equipment and return the client to a position of comfort. Remove goggles and gloves and then perform hand hygiene. Place labels on the container per facility policy, and then place the container in a plastic, sealable biohazard bag or the transport container. Remove other PPE if used and perform hand hygiene. For the evaluation, reassess and evaluate the client's comfort after specific nursing care, and then transport the specimen to the laboratory immediately. If immediate transport is not possible, check with the laboratory personnel or policy manual if refrigeration is contraindicated. For the documentation, document the collection of the sputum specimen on the client's chart. Include the amount, color, consistency such as the thick, tenacious, or watery, the presence of hemoptysis, blood in the sputum, the order of sputum, any measures needed to obtain the specimen such as the postural drainage, and any discomfort experienced by the client. Record the findings and nursing care given, and then make an appointment either for a clinic or a home visit. That will be all for the sputum specimen collection. Again, I am Agatha Mamaril from BSN 2C, and see you in my next video.